Aloha kako! Next week, March 11th to the 15th, we'll be celebrating Patient Safety Awareness Week. This week set aside nationally to focus on the importance of making healthcare as safe as possible for everyone. One of our most pressing patient safety challenges is identifying someone in distress, in particularly respiratory distress. With each breath, your body is able to extract vital oxygen from the air and send it throughout the body. This process is known as respiration. Unfortunately, there are times when your body's unable to draw enough oxygen from the surrounding environment or when it has to work much harder to get the supply it needs. You then enter the state called respiratory distress. In Hawaii, there are many conditions like flu, pneumonia, RSV, and COVID that can contribute to respiratory distress. In addition, there are such chronic inflammatory disorders like asthma that also cause breathing problems. According to the National Institute of Health, the National Library of Medicine, children living in Nanakuli and Waianae communities are more likely to have asthma than compared to children living in other areas throughout the state. At the health center, we see a number of patients, children and adults who suffer from asthma. Thus, it's more important that we all become maka'ala, alert, watchful, and aware of someone who may be in respiratory distress. No matter if we're a receptionist, a clinical assistant, a transportation driver, groundskeeper, medical assistant, billing representative, a technician, a community health worker, therapist, case manager, nurse, or provider. All staff must be able to recognize when someone is in distress and take appropriate actions to assist the person and reduce the risk of poor outcomes. As stated in our core values, it's our kuleana, our responsibility and role to keep mastering and perfecting our skills as we all choose to work and serve in community health centers. This week, we'll learn how to become maka'ala to someone in respiratory distress, identify signs and symptoms and actionable steps to help our community be safe. So please look for emails coming out each day next week with information, education, and prizes and participation. Let's all participate in being maka'ala. Mahalos.